sit and rest just fine. But when you start walking, the muscles in your legs need more blood. They need more oxygen, and that narrowed artery just can't keep up. At first, the symptoms whisper, then they talk. Eventually, for some people, they shout. There's one early leg symptom that almost nobody connects to circulation trouble, and it shows up long before classic pain when walking. I'll tell you exactly what that is in just a minute when we talk about symptoms. But first, let's talk about why this happens. If you ask most people why arteries clog, they'll say, well, it's cholesterol. That's what my doctor told me. LDL, HDL, statins, all of those things can matter, but cholesterol is clearly not the whole story. In fact, it's not even the biggest part of it. The deeper problem behind PAD, heart disease, and a lot of other chronic conditions is something called prediabetes, insulin resistance. You may have heard that term. Every time you eat, especially foods that have starches or sugars, carbohydrates, your blood sugar will go up. Your body releases insulin to move that sugar out of the bloodstream and into the cells. For a while, that works. But after years and decades of too much sugar, those parts of the cell we call insulin receptors, as they get older, they don't respond as well to insulin. The cells start tuning out the signal. They become insulin resistant. That's how that name came about. Now you've got two problems. Blood sugar staying higher than it should, and now insulin is staying higher than it should be. Both of these drive inflammation. They irritate the artery lining. The smooth surface becomes rough. It turns into Velcro. Plaque starts to form. This happens even while your fasting blood sugar and sometimes even your A1C can look normal. If that insulin is too high, we see that all the time. That's why so many people are walking around with PAD, peripheral artery disease, or plaque in their arteries. It can be arteries to the leg, it can be arteries to the brain, and it can be arteries to the heart. And their labs, or at least the labs that their doctor is getting, just don't look that bad on the surface. Peripheral artery disease, for many people, is really a metabolic disease that shows up in the legs first. You're not just dealing with bad pipes, you're dealing with a problem in the fuel system, the way your body handles sugar and insulin. Now let's talk about symptoms. The textbook symptom of peripheral artery disease is called geek warning. Don't have to know it. Don't have to remember it. The doctors call it claudication. It's basically just pain and cramping or tightness in the legs when you walk. And it goes away when you rest. So let's talk about what's happening. If you think of those muscles in your legs like engines, which is what they are, walking is like pressing the gas pedal. The engines need more oxygen in the blood. If that artery is narrowed, not enough oxygen can get through. The muscle complains. It hurts. It burns. It feels tight. It cramps. You have to stop walking. The demand then goes back down when you stop walking, and then the pain fades away. That pattern, pain with walking, relief with rest, is the classic sign for that term that the doctors call claudication. Your muscles are cramping up, they're burning, they can't get the oxygen they need. Now, here's where a lot of people get into trouble. Peripheral artery disease doesn't always act like the textbook. Some people hardly get pain at all. Instead, they notice tired, heavy legs, cold feet, even when the room is warm, numbness or tingling, shiny, thin skin on the lower legs, sores on the feet or toes that are slow to heal, less hair growth on the shins, and sometimes nothing, no symptoms at all. The body quietly reroutes blood through smaller vessels, and you feel okay, until one day there's a non-healing wound or a sudden clot or even a stroke. Let's get back to that early warning sign I mentioned earlier. One of the most important early warning symptoms I see or sign is before full-blown pain is just leg fatigue. It's not just I'm out of shape. It's more like my legs just don't work like they used to. People will say, I used to walk all over the grocery store, and now I need a cart just to lean on it. I'm not out of breath. My legs just feel like they ran out of gas. That quiet, early leg fatigue, especially if it shows up on both sides and gets worse with walking, is a major clue. There may be a circulation problem. If that sounds familiar, you don't need to panic, but you do need to pay attention. Let me tell you about George. That's not his real name, but we'll call him. George was in his late 60s. He's always been active. He worked in the yard, played with his grandkids, walked the dog every morning. But then over a couple of years, he noticed something. At first, he thought, well, I'm just getting older. The yard took longer. He started using the riding lawnmower more and more, and the push mower less and less. And this seemed to just happen all of a sudden, just over a few-month period. By the time he saw us, this is telemedicine, he could barely walk from a parking lot into the store without stopping. His legs weren't just sore. They felt weak and heavy, almost like someone turned the power down. He'd already been told by one doctor, you're just deconditioned, walk more. Another doctor said, it might be your back. Why don't we start doing some x-rays and MRIs? When we looked at him, it turns out he had PAD, peripheral artery disease in both legs. And he also had significant plaque in his heart arteries. His legs were the early warning sign. Everyone was listening to the excuses. No one was listening to the legs. Stories like George are exactly why I made this video. Now let's talk about what you can do to reduce the risk and slow the disease. Lifestyle changes. They can sound vague and soft, right? Eat better, move more. You've heard that 1,000 times. It really doesn't make a whole lot of sense, and that's what my patients say as well. But the science around certain patterns is actually very strong, and it's not that vague. One major study in JAMA looked at a Mediterranean-style diet. Believe it or not, and hang in there, I know we've got a lot of very low-carbers listening that don't like Mediterranean diet. This was a Mediterranean-style diet with extra virgin olive oil and nuts. The group using olive oil and nuts had about a 30% reduction in major cardiovascular events, heart attacks and strokes, and that was compared to more of a Western standard American diet. Here's what I think about it for PAD patients, peripheral artery disease patients. A lower carb Mediterranean-style diet works even better for most people with peripheral artery disease. It doesn't just help cholesterol, it helps lower insulin spikes. And we have tons of patients on keto diets, ketovore, lion diets, different versions of carnivore diets. Those help. We even have patients on vegetarian and vegan diets. But again, you just need to watch your carbs, especially those high glycemic carbs, the carbs that increase your blood sugar and therefore increase your insulin. Because remember that resistance to the insulin, or what they call insulin resistance, and inflammation, these are the things that are driving the damage. High blood sugar and high insulin for hour after hour. That's what drives the damage because it drives inflammation. Inflammation is what's damaging that artery lining. So what does this look like in real life? Plenty of non-starchy vegetables, healthy fats like olive oil, nuts, avocados, and yes, I'm totally fine with saturated fats. I just don't eat a lot of them because I gain weight when I do. Moderate amounts of protein, very limited sugar, very, very limited refined grains. Watching starches like bread, pasta, rice, potatoes, and keeping portions small or replacing them. The goal is not perfection, at least it's not for me. The goal is to avoid chronic sugar spikes, keep insulin down, keep the arteries in a calmer, less inflamed environment. That's one of the most powerful long-term strategies to slow peripheral artery disease and to reduce risk in the heart and brain too. Now, let's talk briefly about medications. Nobody loves adding more pills. I don't either. But for some people with peripheral artery disease, medications can save lives and limbs. I'm not treating you personally here. I'm just explaining categories so you can have a better conversation with your doctor. There are three big players in the prescription medication space. Antiplatelet drugs, for example. These include aspirin and, again, a geeky name, clopidogrel. Think of platelets as the sticky pieces in your blood. When the inside of an artery is rough or narrowed, platelets can clump and trigger a clot. Antiplatelet drugs, like just plain old aspirin and clopidogrel, make the blood less sticky. They've been shown to reduce heart attacks and strokes in people with peripheral artery disease. Another geeky term, rivaroxaban. And this is a combination. This next one is rivaroxaban, or Xarelto. You may have heard it by the brand name, Xarelto. For